Hematopoietic stem cells reside in our bone marrow and produce red blood cells, platelets and white blood cells, the cells of our immune system. Due to cytogenetic changes, hematological malignancies can occur, which will damage the production of healthy blood cells. This occurs in acute myeloid leukemia, in short, AML. Despite intensive chemotherapeutic treatment protocols, in some pediatric patients, the AML can relapse. Children will then be treated with a combination of chemotherapy and stem cell transplantation. The aim of the intensive chemotherapy is to achieve complete remission. After a short recovery period, a preparative chemotherapy is given to the patient prior to the infusion of the donor stem cells. Donor umbilical cord blood, harvested from the placenta after a delivery, is a rich stem cell source. These stem cells can engraft an empty marrow and develop to a new potent donor immune system. Despite this intensive therapy, the survival chances are still 50%. To improve the prognosis, the UMC Utrecht has developed an adjuvant dendritic cell vaccination. The vaccine will activate the newly developing immune system to recognize and destroy remaining AML-blasts. To produce this vaccine, stem cells are isolated from a part of the umbilical cord blood unit. The separated stem cells will be expanded in a specialized laboratory. Subsequently, a mix of growth factors and cytokines will be added. This differentiates the stem cells into dendritic cells. Dendritic cells orchestrate the immune system and can prime naive T cells to recognize specific tumor antigens. The mRNA of an AML-specific tumor antigen will be electroporated into the cell. This will lead to presentation of a broad spectrum of epitopes on the surface of the dendritic cell. Subsequently, a mix of stimulating factors will be added in order to express co-stimulating receptors necessary to activate naive T cells in the patient. The dendritic cells are ready to use for the last phase in the treatment protocol, the vaccination. The vaccination will be given 2 months after the transplantation. The dendritic cells will be injected intradermally, close to lymph nodes. There, the dendritic cells will meet the donor T cells from the same cord blood. Due to the combination of specific epitopes and stimulating receptors, the naive T cells will be activated and primed. The primed T cells proliferate, resulting in mass expansion of specific cytotoxic T cells, which can distribute throughout the patient's body. They will enter the bloodstream and arrive in the bone marrow. The specific CTLs recognize and destroy remaining AML-blasts. The whole marrow is now filled with healthy stem cells, which can further develop in a potent new immune system, resulting in better survival chances. Dendritic cell vaccination, a novel adjuvant treatment modality in combination with umbilical cord blood transplantation for relapsed AML.